Starting now. Testing, testing. We should be live on Facebook here. Testing, testing, testing. Testing. Let us know that you're out there. We're ready to get started. Let us know that you're out there. Let me go do a check. What's wrong? What's wrong? Go to aspirational insight.
Tanesha, tell Q Walk so what's up.
It's on, but it's on my business page. It's up there. We're rolling.
Come back around.
Just share it on your personal page, Dr. Clark.
Huh?
Just share it on your personal page. Or you try to get it on your personal or your business page?
I want it on my personal page.
Just share it from your business page to your personal page.
I'm great.
Yeah, I'm great too.
I thought Clark was great.
From your business page to your personal page.
So,
Yeah, I'm great too.
The feedback is when I'm on the phone. Are y'all there? Okay, we are super excited to begin this live broadcast. We've had technical difficulties, but we're not going to let that disturb us. But we want to let everyone check in and let us know that you're there. We see our views going up. We're up to 7. We're up to 8. I want you all to connect and give everybody a little time to get in. Murphy's Law says, whatever can happen will happen, and that's especially true when you're getting into good trouble on behalf of marginalized groups. So I want to welcome everyone to this week's episode of the Good Trouble podcast. We have several esteemed guests that we're going to recognize, but I want to give everyone time to share the link. I just shared it on my page. Everyone was expecting this link to come up on my personal page. Unfortunately, or fortunately, we could only get it to come up on my business page. So this gives you an opportunity to see our business page, join the link, and of course, like our business page. We're super sorry about the delay, but we're gonna get into the conversation. First off, we're excited to have our guests here, and thank you, our viewers who tuned in for the second time for our great podcast. Here's what I know. 2 weeks ago, we had over 1,000 views, and that speaks to the interest in this conversation of greater access and opportunity for everyone across our country. There's some things that should be basic rights, and we're super excited to glean and shed some light on those topics today. What about our guests? First off, I see on the screen, and I'm just going in order of the screen, John Scroogie. John is a colleague of mine and a friend from Thought Exchange, and he's hailing from Canada. And he's going to be with us today for two reasons. Number one, to lean into this conversation and talk about the inequities we're experiencing and what is he seeing in Canada. John, thank you for being here. John is also going to run an exchange so that we can hear from you in terms of those things that you would like to hear more about and those opportunities you want us to delve further into. Give it up for Toriano Porter. What's up, Toriano?
Thanks for having me.
Oh man, thank you for being here. If you all don't know, Toriano is on the editorial board of the Kansas City Star, and he's an esteemed author, and we're super excited, and it's an honor to have you here.
Thank you, Dr. Carter.
Moncello Steward. If we had more time, I might say Blue Fire, but we don't have that much time, so we got to keep it moving. But Moncello Steward is a grassroots organizer in Savannah. He's also a political strategist, and I'm super excited to have him here with us. Moncello just had an exciting thing occur with his business, but they were able to successfully elect an African-American male mayor for the city of Savannah. So we're super excited. Moncello, thank you for everything you do, man, on the political front.
Thank you, Coach.
Cokethea Hill, that's my business partner, my friend, Cokethea Hill, deep in this equity work in the Metro Kansas City region. Coco, thank you for being here. And Tanesha, giving us that medical expertise. Tanesha is an RN who specializes in the NICU space, but she's also a clinical educator. And that's what makes her super important to this conversation, one who always brings an equity lens to her work. So today's topic, we're going to delve right in. We've had our audience waiting long enough. We're going to delve right in. And the question that's on the table is why? Why? Why are African Americans being more negatively affected by COVID-19? That's a big question. We're going to put it out there tonight. We're going to go deep into this topic. And in my mind, before we get started, we have to chase this rabbit down two holes. We have to look at this and we have to chase down the medical hole. That's super important. But we also have to go down the policy hole, because that's something that I believe leads to the medical inequities that we see and experience. We heard our president today, and I'm just going to keep it real. He's turned what were briefings to give our country information into political campaign opportunities. And that tells me that the inequities that we're experiencing in our community, he must not be very, very concerned about them. I think he's only concerned about being reelected. No one on the show has to share those views, but those are my views, and that's going to kick us off, and that's going to get us started. First question for our esteemed guests. Let's start with the why. Why are we being so negatively impacted in the African-American community here in the United States as it relates to COVID-19? What are some thoughts that come to mind? Toriano, get us started.
Well, I'll tell you what, Dr. Carpenter, when we look at some of the data and some of the numbers, it's heartbreaking to see what's going on in the African-American community. I know in Louisiana, Black folks accounted for 70% of the death, coronavirus-related death in that state. It's only like 32% of the population, or 23% of the population. The number is very disproportionate. In states like Illinois and Michigan, Black folks accounted for 40% of the deaths already. In my hometown of St. Louis, the first 12 people that died from coronavirus-related deaths were Black folks. When you see that, even here in the Midwest, when you see that, you have to start looking at the why. And the why is systematic, institutionalized racism, pervasive racism that has caused a disadvantaged folks in Black and brown communities. That's my thought.
Absolutely. And we want to, first of all, honor those comments, because we are going to dig into the systemic elements of this conversation. Also, to our viewers, we can see all of your comments. Please place your questions in the space, and we're going to delve into your questions as well and make this as interactive as possible. Moncello Steward, when you see the numbers as it relates to African Americans being the most identified and leading in deaths as it relates to coronavirus in such a disproportionate way? What comes to mind for you?
Man, immediately it's politics. It's politics. It's the systems that were already set up before this virus even hit. It's housing discrimination. It's job opportunities, and those are the things that really matter. And so when you're hit with an epidemic as such, and you already have systems in place that play against a certain population, those people are going to be affected the most. And so when you have areas where low income hit, now you're trying to tell this low income, you're trying to tell a low income family what and what not to do. They only think about one thing, pandemic or not. They think how to survive. And I think we got to get politicians, elected officials in here to understand that we generally try to elect elected officials who sit on the big top of a house and look down on us, and they don't understand those issues that we have. And so I think that's one of the biggest issues, is electing the right local politicians to fix these issues.
Absolutely. So when you bring up politicians, that's something that's been on my mind as well. Oftentimes we say, well, why don't our people just stay in the house? And that's super important. Folks need to stay in the house. But what about the systems that don't allow you to safely stay in the house? What about those political systems whereby we don't get preventive care? We don't get preventive care. There is no Medicaid expansion in Missouri and Kansas. We struggle with those things to get us in front of doctors and the like. So until we get the politicians in place that can assist us with that, we're going to struggle. Thank you for elevating that conversation, one that will continue to be a thread as we move through the conversation. Ms. Hill, what comes to mind? Consistent, pervasive inequity as it relates to this pandemic.
Yeah, I mean, I'd like to echo the same sentiments as everyone on the panel. When we talk about health, we often talk about personal choice, but we don't talk about the social determinants of health. These are the conditions in which people are born, they grow up in, where they live, how, what kind of jobs they have access to. So when we think about the social determinants of health, we look at your built environment, we look at your employment or unemployment status, we look at your social supports and networks, as well as your access to care. So you think about disinvested communities, urban communities, and if I can just speak briefly about Kansas City, there's a great book called Race, Real Estate, and Uneven Development. It's by Kevin Fox Gotham, and he talks about how Kansas City in its formation stages, where race was a driver, people couldn't live in certain areas because of racially restricted covenants. If we think about, following World War I and II, when we had Black folks that were looking for the GI Bill and wanting to take advantage of the Home Loan Federal Bank Act, they could not. They were denied access to home ownership, which we know is a cornerstone of building wealth, right? And so if we fast forward and you look at the Highway Act, how it bifurcates many of our communities, and we know how that air pollutes our communities, right? And so we think about those synergistic effects. We think about urban planning and development, how everybody will say in any urban community, you have more liquor stores and fast food restaurants, but we have food service deserts, right? But we don't have quality access to fresh fruits and veggies. We don't have amenities in the community because of this economic development trend, which says that amenities follow rooftops. So if you continue to concentrate people in low-income census tracts, right? You continue to have multi-family, substandard housing where folks might have to enter one door to go to all their apartments and come back out. And they are, on top, high-rise on top of each other. When you think about the lack of public infrastructure, like sidewalks and curbs, go and look at our community. We have crumbling infrastructure. So how is, as the Attorney General says, how's Big Mama supposed to go out and walk on the sidewalk when you got crumbling infrastructure and she may fall? When we think about just in our community, Dr. Carpenter, if you look at Kansas City Public School District, just the boundaries, and we think about how massive it is, but east of Truth, you will not see one Chuck E. Cheese, one skating ring, one monkey business, arcade, movie theater. So we have no place for our kids to go except for parks, and parks are closed down when it's wintertime. Nobody's out exercising, moving around. So we stack these conditions. And my colleague, Murray Woodard, talks about the compound interest of poverty. He said, it's expensive to get out of poverty, y'all. It costs a whole lot, right? And
Wow.
so you think about them compounding effects of poverty. How can I make a good choice to eat healthy if I'm low income, live in a community where there's a food desert, and I'm gonna pass, no shade, because we like Popeyes, but I'm gonna pass 5 Popeyes before I get to one grocery store.
Right.
Wow.
The menu at McDonald's is more feasible for me. I mean, I just
Compounding effects of poverty. That's super, super important. Cokethea, thank you for elevating that portion of the conversation. We're going to turn to Tanesha, and then we're going to get to some questions that are starting to flow in. RN Thomas, first off, thank you for your service.
Thank you for having me.
Thank you for going into the hospital every single day, putting yourself in harm's way, going back to your beautiful family, and I'm sure that worry that comes with going back each day. Thank you. Thank you for what you do. So what are you seeing on the medical front? And give us some perspective around why we're in this space from a medical standpoint as African Americans.
I think I'd like to start off by acknowledging that, the corona pandemic, of course, is not going to be selective in its prey. However, it is bringing to light all these adverse health outcomes, as Dr. Hill had just spoke to you about the social determinants. Now, all those social determinants, unfortunately, the education, the housing, the low-wage jobs, all of that is kind of putting a lot of stress on our community. And what ends up happening is now that kind of comes out in medical standpoint, particular conditions, hypertension, obesity, diabetes, chronic kidney disease. And so you have a population that is already physically inept. Now you add on this coronavirus that then takes a catastrophic toll on the body, and that body does not have the ability to fight back as someone who is healthier. So if I'm an obese patient carrying around 300 to 400 pounds, and treatment is you want me to lie prone, lie on my stomach for 18 hours a day to expand my rib cage, I can't do so as an obese person. Therefore, the remedy that would help me is actually going to hurt me. So therefore, I can't get better like other constituents who may be not obese, but have a healthy BMI. So they can lay on their chest for longer periods of time. So for us, this is not new to us in the neonatal community, because the neonatal community is the same reason we have high preterm births as an African American community. Is the same reason we're not able to get over some of these outcomes from COVID.
Wow, thank you. And John, we have been grappling. We had a candidate that dropped out of our presidential race here in our country, Bernie Sanders. And one of his policy positions was universal health care. And that's a policy position that I believe coronavirus and COVID-19 is really shining a light on. As a Canadian, you all do have, to the best of my knowledge, universal care. Talk about that and talk about how that's playing into differences you may or may not be seeing relative to the coronavirus pandemic.
Yeah, I mean, it's something that I'm incredibly thankful that I do live in a country where, if I get sick, I'm not worried about, is my insurance going to cover it? I'm not worried about getting stuck with a massive medical bill. This is the society I grew up in. If I get sick, I go to the hospital. It's all a collective good. It's all a common good. Now, I wouldn't say, it's not a perfect system. Obviously, there are still challenges with it, but just the fact that folks don't have to worry if they're going to go bankrupt, if they need some kind of treatment, if they need to go to the hospital. So there's inherent equity in that we all pay into that through our taxes, and that's where it comes that idea of single payer. It comes out of from the tax base, and it's a public good that everyone can access. So yeah, I see this. One of the elements of this coronavirus is that in one sense, it is a great equalizer because we're all dealing with it. but it is, of course, now, as we're all discussing here, exposing those systemic inequities that exist in different societies, and not just in the United States, not just in Canada, but people all over the world that are struggling with this. And one of the things that's really come to my mind, I've been reading a lot about it, but this notion of, oh, hey, social distancing is what we need to do. Social distancing is a privilege. There are some people who are able to do it through the way that their life is set up, the access to whether they can work online or not, the type of employment they have or not, and the type of housing they live in and the society they live in or not. And it's these types of things that are getting exposed. And if there is any silver lining in this situation, is that these type of things are becoming more apparent to people.
Yep.
Absolutely. So when you bring up this notion of workers, this is something that I've kind of tweeted about and I've posted about here in the last several days. There's no doubt in my mind that there are service workers who were told days before the pandemic that they were expendable. Put another way, if you don't show up, I will fire you. If you're not on time, I will fire you. If you stay on your break too long, I will fire you. And only 1 second separates one day from another. In that 1 second, they became essential.
Wow. They're
in that 1 second that separated one day from another, pre-pandemic to pandemic, these same workers became essential. So what does that mean? That means the young girl, the first day of closures that I ran into at Home Depot, 17, 18 years old, working, trying to find her way through high school and into college. She has to meet every single one of Home Depot's customers. And then she goes back and she lives, in some cases, and this girl told me, and I live with my grandma in a multi-generational home. So social distancing is a privilege. And some of us want to harp on, and we're going to touch on it before we end. We want to harp on the bad decisions that are made in our communities. Well, here's what I begin to think about these bad decisions. See, my mom told me growing up, boy, you're going to have to work twice as hard to get half as much. And when she told me that, I digested that in terms of the workplace, in terms of school. So I kicked everybody's butt in my classroom at school that I could kick. And when I got to college, I did the same thing. And when I got to the workplace, I did the same thing. And then I had some white folks in the community after me, and I gave them one thing that they could shine a light on. And guess what my mom told me? You remember what I told you? Don't give them nothing. Because if you give them something, they'll take advantage of it. But I digress. Here's my point. We also, from a medical standpoint and a health standpoint, have to work twice as hard to get half as much. What do I mean? Hy-Vee, just the other day, here in our community, we had to expose this notion that they have delivery within a 5-mile radius. But when that 5-mile radius touched the Black community, Hy-Vee would not deliver until they were called to the carpet. Thank you, Kansas City Star and others that assisted in calling them to the carpet, and all of a sudden they want to deliver in our community. So I can't find healthy food options, going back to Cokethea's point, but I can pass Popeye's chicken 6 times. And the healthy food option is expensive, and Popeye's chicken has 5 pieces for $5.
You know, Dr. Carpenter, I have to jump in there. I had a hand in penning that editorial for the KC Star, and one of the things that the people from Hy-Vee and DoorDash told me was all they had to do was enter 64132 zip code into the system and activate it. And I thought to myself, well, if you had it in the system and all you had to do was activate it, why didn't you activate it when you initially rolled out your new plan to deliver groceries? It makes no sense to me. It's intentional. The excuses were hollow, and this thing been going on in Kansas City for decades, and it needs to be called to the corporate. And if you're going to do business in this city, you have to take into account the historical context of everything that goes on, especially East of Truth.
Mm-hmm. Well, and also, Carl, that goes back to what I was saying about the local politics. You said something about food deserts. Listen, any elected official that's running for a district seat, a county seat, a city, they all know their local food deserts. They know the areas and the things that those people can do when they come together. They could give tax breaks and tax incentives for businesses that want to come in those areas to open up places, healthy places, so that those people who's already marginalized can now have the same options that some of the other communities have.
Yes, thank you, Dr. Lance, for tuning in. Superintendent Lance says, are we dispensable or indispensable? The answer depends on who you ask, but the truth lies in the response. Policy, access, supports, etc. Rhetoric is cheap. And unfortunately, here in our country is being built on rhetoric and sound bites. It's being built on rhetoric and sound bites. Once again, if you saw our president today, he started the press conference with sound bites, not substance. And a few days ago, we heard are really concerned about the disparities in the Black community. It was said once, and we have not heard it. I watched the press conference as a student of leadership every single day. And I heard it come up once. I have not heard it out of my president's mouth again. So the local elections are super important. Thanks for elevating that. Who we elect locally matters. You don't get to sit out. If COVID-19 has taught me anything, it has taught me that we don't get a chance to take a day off and sit out of the political process. We do not get a chance to take a day off. So a question here that I wanted to build on. Historically, Sean Kirkwood, African Americans are weary of government, and for good reason. How can we overcome that in regard to how we receive and disseminate information from the same government that gave us syphilis and gave our Native American brothers and sisters smallpox? This gets to this conversation about conspiracy theories and not believing. When the pandemic started, I heard many of my brothers and sisters, Kirkwood and others, this is a great, great conversation to bring up. I heard this notion come up of Black folks can't get it. We don't have to worry about it. They said we can't get it because of the melanin in our skin. And I paused and said to someone who said that to me before we even got into the space we're in now, you name something in these United States that has been negative that we have not gotten the worst end of. So if you want to start off by believing that we can't get it, shame on you. I will not be believing that. And it wasn't 2 weeks later, we were disproportionately leading the way. So how do we trust a government that has, in the words of Sean Kirkwood, given us syphilis to our ancestors and our Native American brothers and sisters smallpox? And there's conversation now about immunization and the like. How do we trust our government to do that and do that well? Tanesha, I want you to start that one off for us.
Well, I think there's always going to be a little bit of skepticism because of the historical aspect of it. I think, but the most important thing we have to do as people is to educate ourselves. So, for instance, there was a conspiracy theory that was going around about 5G being the cause of coronavirus. And my 17-year-old son said, well, Mom, that doesn't make sense because microwaves have a higher frequency than it does radio waves. So how would that make sense? But I think a lot of us fall into the trap of believing what other people, tell them, and hence the reason it can get us into trouble. And that's going to be the same where if someone says, oh, well, the government is doing X or the government is doing Y, a lot of people have tendency to believe up here rather than actually believing in the government. Myself, when it comes to vaccines, I am skeptical. I don't want to be on that first wave that comes out. I am going to sit back and see what actually happens because we are developing this one rather quickly. Right. And I always laugh and, I go back to the I Am Legend with Will Smith. But one day, could that be a reality? And is that day today?
Right. Absolutely. Anyone else want to lean into this? How do we trust? I think some of that trust begins when we look at our elected officials at the local level. And then how do we do it from there? Right. I hear Moncello leaning in and Toriano. Either one of you, go ahead.
Right. And goes back to the same point again. It's one of those things where the old saying where either, you're at the table or
I think we lost Moncello.
You know, we got to elect the right people to trust the people.
Yeah, I think you're going in and out. Toriano, take that one for us.
I read a story the other day about a vaccine being used on older patients with Alzheimer's disease without their consent. And it's scary, man. It's frightening because we know historically Black and brown people have been used as guinea pigs in this country. And to read a story about older patients being given this, quote, miracle drug as an experiment without any permission from the family, without any control, that is where the distrust comes in. And then when they come out and they tell us about this, they don't tell us if the patients are Black, white, Hispanic, Asian. America has a history of, you know, pulling fast ones on our community. So I'm very afraid that some of these conspiracy theories and other things will lead to mass confusion among our people. Now, what we have to do as a community, as a group, we have to trust our sources. You know, in the industry I'm in, that term fake news is thrown around a lot, but you have to trust your sources. You have to stay off Facebook and Twitter and go for real information. Now I implore my people doing that. Don't just read and believe everything. Excuse me, just don't believe everything you read on Twitter and Facebook. There's a lot of disinformation out there, purposely done.
John, from a Canadian standpoint, and we're pretty blunt here and pretty candid in terms of what we feel. If the same situation was playing out in Canada, how would you feel in terms of trusting your government?
Well, I think in a way, I mean, the same situation is playing out. Like I said, we're all dealing with this virus. We're all trying to kind of do what we can to flatten the curve, as they say. And I mean, I think I'm coming from a position. I do have a lot of faith and trust in the government. Like I generally in Canada, I do. Not everyone would agree with me. I definitely don't represent the views of all Canadians, but I see the government, you know, as flawed as it is here in Canada, stepping up to take measures to help the citizens here. They've set up a Canadian Emergency Resource Benefit Fund. It's one of the largest federal programs in history to try to provide basically just money for people so that they can get by with their everyday lives when they're not able to work. They're providing wage subsidies for business. So I think there's a lot of you know, admiration for what the government here in Canada is doing. But I would agree with Toriano when it comes back to just trying to get your news and your information from reliable sources. There's a lot of misinformation out there, and you need to maybe do like a little bit of homework yourself and do some fact checking, and even just check it with yourself. Does this seem right to me? But it's tough out there with the internet. There's a lot of things that can mislead people and a lot of pitfalls to get trapped into, for sure.
Absolutely. Wow, what an honor to be able to say as a resident that you can trust your government. Ms. Thomas, go ahead.
You know, for a lot of us who have higher advanced degrees, researching is very easy, right? We're kind of skeptical because that's kind of, as you get further along in education, you're kind of taught to kind of, you know, verify your source. Here in Georgia, the average education level is a 3rd grade level. So if you can imagine trying to tell your 3rd grade child to go and research and verify truths that the president of the United States is saying, or any elected official, really, do they have the capacity to do that? You know, so I think a lot of times, a lot of us who do have that advanced education need to reach out to some of our peers who are spreading a lot of misinformation and correct them. Because once again, if I am on a 3rd grade level, how apt am I going to watch CNN or MSNBC? How often am I going to compare that with what I'm hearing from Fox? No, I want to be entertained. I'm a 3rd grade level thinker. I want to be entertained by Twitter and Facebook and TikTok. And so I think a lot of times that is kind of also creating a lot of misinformation getting out there.
Wow, thank you for that. Thank you for that. And Cokethea, not only as a community leader, but as a mother, Doc, what are your thoughts? What are your thoughts relative to the trust element and vaccinations and the like?
Yeah, people, we believe like people learn, grow, change through relationships. And when I think about all the people that we have that get relationships with Black folks, right? Whether it's our churches, whether it's an elected official, whether it's our school district, like people are connected in multiple ways. And so what we've got to do is start to dispel some of that and really push all of these folks in which we are patronizing to start representing us and sharing the truth and organizing in a way to get the word out. We have forsaken real relationships for something that you can click on and put a button on. And that's good and fine. But you know what? I'm not going to change a practice, a habit, or a belief just simply because I'm being entertained or I got one source. We've got to figure out, where do people get information? Who do they trust? And what's the best medium to provide that? And we've got to attack this from multiple veins. The other thing that I would say is just, it's a double-edged sword, right? Because when we think about vaccines, when we think about clinical trials, we don't trust them as a community. So we typically don't volunteer to sign up for experimental medicine. But that's how we start to figure out, how does it affect people of different ethnicities, right? So when we're absent from those groups, the researchers don't have real-time information. And the last point that I will make, again, I'm going to be the person that's always beating this drum about, we've got to start having courageous conversations about race, because you cannot look at any major sector in our US system and not see disproportionality by race. And in fact, most often, more likely than not, we are on the bottom end if it's a quality of life, or if it's negative, we are twice or three times as likely. One of the things that stuck out to me as a mom is I was reading this research that said for Black African American women, right, with degrees, the more education you have, there's an inverse relationship to the birth weight of your baby, right? So the higher education you have, the lower birth rate your baby is. And I thought, man, how could that make sense? Because if I have a master's or a doctorate like I do, you would think I'm gainfully employed, I have access to health care, I have a primary doctor, I understand, what nutrition, and I'm getting those checks. And even for me, my baby was born at a low birth weight. And the research is saying that the way we internalize stress and racism in our bodies, that's contributing to
in the workplace.
It's contributing to, like, I'm thinking, oh my God, I'm having a Black boy. What does that mean for his life? Oh my goodness, I got to take time off of work. Will they think that I'm not capable? Will my job be there when I come back? How do I balance being a mom and also, being a political person? We've got all of this stuff that we internalize in our bodies. And as you guys know, stress is never designed to be prolonged. It's a fight or flight. It's supposed to be short bursts that either gives us all the energy we need to fight, or it allows us to use all our energy to flee. And what happens is that energy burst comes because our other organs will shut down briefly to allow our bodies to take more of that energy. So if you're in a prolonged state of stress, poverty, homelessness, you in a job where it's toxic, you're not valued, you don't feel belonging, you are internalizing that. And it's having a synergistic effects in ways that you might not see, but might show up like hypertension, heart disease, obese, all these things in ways that we cope. So I just want to say that, guys, we've got to start unpacking how race plays a factor in not only our health, but the place in where we live. And we know that zip codes is connected to not only life expectancy, where I live can determine how long I live.
Absolutely.
So
that is just so big. And I was excited to hear Sean Combs the other day when he basically said this conversation is just a blip on the radar for them, the disproportionality conversation. We have to take care of ourselves, and we have to have our own conversations. And I trust that this is one mechanism for us to do that. So I'm super excited about those points that are being elevated. We have to do this. essential employees. Ta-Nehisi Coates taught us about 5 years ago in Between the World and Me. He said the African-American body and the African-American person is the essential below in the United States of America. Put another way, we are required to be marginalized in order for the United States to operate the way that it does. So the disproportionality relative to COVID-19 is consistent with who's at work. I went to a bank, not my bank, a bank that I don't normally visit. I had to take care of some business with the contractor I was working with. I went into a bank in my community. I'd never been in that bank, so I'll use this as a preface. But everybody in the bank a week ago was a person of color. And for those who know where I live in Lee Summit, Missouri. I can go to banks every day and not ever see a person of color pre-pandemic.
I read a stat that says, I'm gonna read this off real quick. Blacks are more likely to be part of the COVID-19 essential workforce. Black folks represent nearly 30% of bus drivers and nearly 20% of all food service workers, right. Janitors, cashiers, and stockers. We're on the front lines, man, and we're disproportionately affected by this. And it's a shame. And like we said earlier, social distancing is a privilege that a lot of folks, brown and black, do not have, especially black folks.
So someone stated that they want to make certain that I speak about the viral video from yesterday in Pensacola, Florida, if you have not seen it. And the Pensacola, Florida video is an African-American, what appears to be an apartment community. And that group is out enjoying Easter Sunday, cookout, barbecue, and the like, you name it, what we do. And I'm sure individuals who want that conversation elevated, they want it elevated from the standpoint of pulling ourselves up from our bootstraps and doing better. And I agree, we do have to do better. But when there's a government that's been described like the one that we've laid out, a group of 6 educated folks, how do you trust the government and the information you're receiving? And then you end up making poor choices. So I think one of the answers is news outlets that give people of color, like those of you on the screen, the opportunity to share with our community in their language in a way that they can digest the information. So what I am going to say to my brothers and sisters is, until this thing starts to let up and we're clearly on the other side of that curve that we hear about, please stay in the house. And if you don't want to stay in the house to protect yourself, stay in the house to protect your grandmother. Stay in the house to protect your mother. Stay in the house to protect your older siblings. Because contrary to some of the things we have heard, COVID-19 coronavirus is extremely real. It's extremely real.
Absolutely.
So I just want to offer that to my community in the most genuine way that I can offer it. Please.
Please I think earlier you threw some numbers out about Louisiana. I'm looking on some stats myself, and it seemed like those numbers are across the board. I'm looking at Chicago and some other cities where African American population is 10 to 25% of the population, and the deaths from coronavirus is 60 and 70%, and that's just unheard of.
Unreal. But it highlights the inequities we've been talking about all night.
Yep. Essential below. Essential below.
And the greatest one, of course, being that health inequity. And that's going to be the biggest contributing factor. You know, going back to the Pensacola video, you know, I always wonder, are they actually hearing the message? And where are they hearing the message? You know, in our house, once again, the news stays on. In another home, do they even listen to the news? Are they even hearing what is going on?
Mm-hmm.
You know, besides, like I said, little snippets of, you know, things on Facebook and stuff. And so, like my husband was saying, like, how do we reach these youth and give them this message so that they can adhere to it, so you don't see things like what we saw from that Pensacola Easter celebration?
Okay, go ahead.
And that goes back to what we were talking about earlier about, again, local politics. Those relationships got to be built earlier.
Yes.
You know, that community policing and asset build, all that stuff have to happen beforehand, before all this to happen, so that when you come in my community, I know you and I trust you. You just can't pop up in the community and you haven't been there before, and you're telling people stuff and they already do not trust you. So you got to build those relationships prior to all of this.
Absolutely, and that goes to the Surgeon General's comments. That's another topic that we were going to hit on this evening. And here's my take as the host. Our Surgeon General is a man of color, but to my knowledge, he's done no work that I'm aware of building capital in the African American community. So if he has not put in the work to build the capital in African American communities, the comments he made the other day will come across as tone deaf, and they'll come across as shucking and jiving, and they'll come across as dancing when he doesn't hear music. So what I'm going to offer is build those relationships and build those connections with our community, so that when you make that comment, you're not making it in the first time I've heard from you, you were standing beside President Trump.
Yeah.
The first time I knew who you were in my community, you were standing beside President Trump. Those comments would definitely come across as condescending. So that's my take. Anyone else want to take that deep dive into the Surgeon General's comments? That was something individuals wanted us to bring up. Dr. Hill.
Yeah, I want to roundabout and come back to it. Another thing that I feel like the Surgeon General needs to highlight that we don't have data on yet and may not ever is the quality of care. Because we know how implicit bias affects medical decisions for African Americans, how we're less likely to receive medication for pain, how we're less likely to be hospitalized when we need it. And when you hear on CNN talking about doctors and medical professionals are making decisions about who gets on a ventilator and who doesn't, who gets what kind of quality of care, who gets sitting in the waiting room and has to wait, and who gets taken back and triage on. There's so much that we don't know, and because of the pandemic, we don't have somebody going around doing quality control, right? Nobody is raising their hand saying, hey, send me to the COVID virus level at the hospital and let me check quality. What we do know is that there's probably a lack of diversity in terms of doctors in this space. And so when we hear the Attorney General, a Surgeon General making these statements, what we talk about is when you're in a position of authority, we expect you to have the complete truth. So if he would have had the language, which I call family language, right? There's a time for family language when we talk about big mama and cousins and them. And there's a time when we code switch when we're talking and we're being professional. So to me, when you're going to have those kind of statements, then I want you to also unpack race. I want you to also impact how our communities provide this compounding impact on us. I also want you to talk about not just the choices we make, but who makes choices for us. Like Marcella said. So let's talk about who's making choices. In education in any sector, we are always putting the entire blame on the people, right? In education, we see it, all those parents, right? All those kids. No, what is the system of education? How is that intersecting with our kids? How is the system of neighborhoods? How are the systems of hospital intersecting with race? And I'm telling you, we're not coming out again, which is no surprise to us, on the losing end of deaths. We might be surviving, but we don't know that type of data on if you coming in and you just got the call, but somehow you end up sitting in a space with other coronavirus folks and waiting to get help or getting sent home. So
let's go to some of our viewers. Let's go to some of our viewers, and we have some questions that tend to be piling up. Someone says, Tina Rambo Faulkner, how are you doing? They also want to do testing in Africa. I wonder why. I think we've kind of unpacked that already. And the people that I met in Ghana, my friends, my family. Wow, that's a tough one. Thank you, Dr. Dotson, for checking in as well. Brian Williams, how much of a negative impact is this going to have on our children who are having to finish the school year at home while mom and dad are having to battle on the front lines as essential workers? This is something that can turn into a whole new trauma that our children have to face. Trauma for our youth. A lot of our kids have left the one sanctuary that was theirs, and that sanctuary was a place called school. And until our government and until our community leaders believe that our children are worth the investment of eliminating their trauma, whether it be in their communities, in their homes, and unfortunately sometimes in their schools, then we can only pray for our children. Cassirian and Garen, how are the children? Thank you for elevating that, Brian. Crisis communication message has to be crafted and delivered for a fourth grade comprehension level. We just talked about that. And that's a part of what we're trying to do, is make the message extremely, extremely plain. Thank you for that thought. Okay, I saw something else here. Everyone doesn't have cable either, which is where the news is shown. Xfinity cable, $100+ a month, plus an extra $8.99 for Netflix. And some people are literally not seeing anything from a reliable source.
Right.
Holding this thing all day and not looking at anything from a reliable source. So how do we get into the spaces where our people are and have these conversations via a context that they can both take in and comprehend? That's what Good Trouble is all about. Thank you for elevating that.
I think while there's a lot of people who may not have cable or streaming, I will say the majority of people do have some type of electronic device, like you pulled up the phone. And so where you might not be able to watch the whole briefing that the president decides to give, you at least are able to kind of scroll through articles. Once again, though, it's knowing what articles. So I think if, as you know, if we can put out more and more positive articles that is actually highlighting from credible sources, that can help our community to say, oh, let me click on this link, because it's from a reliable source. But once again, you're still going to have to discrepancy between what is reliable and what is not.
What is not, absolutely. We're super excited to have checking in the comments, a hospital system COO, that's Tiffany Johnson Lewis. She says poverty in and of itself is a barrier to care. We've heard stories right here about people getting turned away from care. And she says our most vulnerable populations are the ones suffering the most. Healthcare is a basic human right, and until it is addressed, there will always be inadequacies. A basic human right, and until we do so, there will always be inadequacies. So hopefully, as we saw some alliance between candidate Biden and former candidate Sanders, hopefully that piece of universal health care can remain a policy position as we move into November. Thank you for elevating that conversation. Here's something we have not thought about, but it's super, super important. What are we doing to address PTSD of our essential workers? Just the fact that you're getting up every day knowing that you're putting yourself in harm's way, working an 8 to 12-hour shift, knowing that there's a possibility you're going to go hurt your children and your family back home.
In the parking
Dr. RN, speak to it.
I would say in the parking deck at our jobs, if you're going in at the beginning of the shift, there is a lot of spiritual music playing. I think everyone, in their mind, they're trying to guard themselves with spirituality to combat what's to come. Because we do know that we're going inside of an environment that increases our exposure, right? The more often you go in there, the more likely it is that you're going to get something, the more likely it is that you're going to bring that home to your loved ones. So like for myself, when it first started, I am working in a facility that is the epicenter, one of the epicenters in Georgia. I had to be isolated from my family for 3 weeks. My husband kept me in our bedroom because he did not want that possible exposure. Now in the NICU, our exposure level is very low right now, but as an educator in the hospital system, I had to go around and, of course, perform other roles that put me in harm's way. And so, luckily, I do work for a healthcare system that is heavily investing in the wellness, the mental wellness of its employees. There is daily briefings about those services that are free to us. So hopefully, other employers will follow suit and do the same.
We've had so many questions come in. We've had so many viewers. We could really literally go all night. I do want to elevate a couple of comments that are here before we try and wrap up. This is what Good Trouble is all about. We're going to bring in the experts. We're going to dig deep into the conversation. This is what it's all about. Dr. Bedell is checking in by way of his wife, Robin. Great discussion tonight. Hotspots are coming in to address disparities in the Kansas City, Missouri School District. Thank you, Dr. Bedell. Thank you. Wi-Fi hotspots. Additionally, school buses are being equipped as we speak with Wi-Fi and are being piloted in Wi-Fi deserts right now. Thank you, Dr. Bedell. Thank you for doing the real work, sir. As we think about wrapping up, what we want to do is we want to have the right conversations for our community. And the only way to do that is to hear your feedback in terms of what you like to hear about next. That's part of the reason that John joined us. John is a leader at Thought Exchange, and there's a platform to get everyone's voice into the conversation. I'm going to turn it over to John because he's going to help us learn what our folks want to hear about next. John.
Yeah, thank you very much, Dr. Carpenter. Okay, so the first thing, Dennis, what I'm going to do, I'm just going to put a link into the private chat here. If you can share that out on Facebook Live with all the participants and all the guests, then that'll be the easiest way for them to get in. But I'm also going to share my screen with everyone and just show them another way to get in if they want. But the easiest way would be for you all to click on the link that Dr. Carpenter is going to share out. But for those of you who can't see that link, if you can everyone see the screen that I'm sharing now? Is everyone able to see that all right? Can I get a yes if you can see it? Dr. Carpenter, is everyone able to see the screen I'm sharing?
I cannot see it yet, but let me see. I'm going to put the link here. Here's the link going in here.
Sure. So once everyone sees that link that Dr. Carpenter is going to share with you all, just go ahead
and take a look at the link. The link is there. We can't see your screen, John, but we can see the link.
Okay, that's no problem. The link is all you need. Then if you can see that link, you're going to click on it, and that's going to bring you into the Thought Exchange conversation. And this is where we want to get your feedback on and answer this really important question. So it's as we continue to examine inequities during the COVID-19 crisis, what other areas of equity do you want us to explore in support of marginalized groups? So go ahead, click that link, come on into the conversation, and please share your answers to this question. And once you've gone ahead and shared some answers, I want you to also go on to the next spot and start reading other people's ideas and just give it a star rating out of 1 to 5 stars. And in all this, your participation is purely confidential. There's no names attached to anything here. Nobody will know whose thought came from whom. And in this way, the platform is really an equitable place to share some ideas. So again, just go ahead and click that link that Dr. Carpenter shared with you all and come on in and share some ideas. And that way we'll have a better idea of what to explore in further conversations like this.
And please share that link as well on your Facebook page. John, how long will the link be active?
It's going to be active as long as you want it active. I have it open, and you can let me know how long you'd like it active for.
I'm in it now. We have some people that are already talking about the financial implications and the financial inequities around the stimulus package. Absolutely. Let's give everyone time to get started here.
Yeah, it looks like I can see 8 people have been able to get in so far, but no thoughts are shared yet. But that people are probably just thinking about what they need to type. So we'll give them some time.
somebody there.
Do you see any thoughts being shared?
Yeah, I see there's one thought in there so far. We're getting more people coming in, so this is good. This is always the part of the thought exchange where everyone gets real quiet because they're on their devices sharing thoughts and everything.
Yeah, it's taking people out of the live broadcast unless they do two screens. You have to do kind of a split screen. But here's what I do know. What I do know is if you give us feedback by way of that link, and I'll be posting the link, then we will make sure that we find out which topics emerge as the top topics, and those will be the topics that we explore on the Good Trouble podcast. Those will be the topics that we'll bring in experts to address. Thank you all for being here. Give it up for all of our panelists. Tanesha, be safe out there in the hospital. Toriano, keep shedding light on the important topics. Cokethea, my sister, keep up the work. This is the real work. Moncello, keep getting the right people in office at the grassroots level. And John, keep providing a space for us to share our stories. This is the Good Trouble podcast. Thank you for being here tonight. Take care of our folks. Stay home and be safe. And the story is never the story. Look at the inequities. There's always a sub-story. And be a disruptor. I heard Dr. Lewis here saying, who's going to be a disruptor? Thank you for being here, Dr. Lewis, Lawrence Superintendent. Who's going to be a disruptor? I'm going to challenge all of you to be a disruptor in the spaces that you command. And thank you for joining our podcast this evening.
Outstanding. Thank you.
All right.
Thank you. Thank you.
Thank you.